need to stop looking at patients and thinking, oh, that patient's got dementia. We need to look at the person.
Do all work as a team, you've got a happy environment, and then the patients feed back on that.
It's a responsibility of all staff to approach each patient from a position of care and respect.
Dementia is a terrible disease. It affects the mind and it can affect young and old. It depends which part of the brain it actually affects as to how that then affects the personality of the person.
Mallard Ward has been open for the past almost 3 years, open specifically to care for people who have either medical illness associated with dementia or people who become acutely confused, in other words called delirium, because of another medical illness.
They may have loss in inhibitions, they may have different feelings. Some people can be very loving, some people can be very agitated. Get to know that person as a person, so it's like looking beyond the disease.
Communication is vital, I think, for anybody that has dementia. Each person is an individual, so you've got to try and learn how they like to communicate, what they can tolerate. Some people don't like loud noises, some people you can have a laugh with, so it's trying to find that bit of a middle balance really between them.
The only way we can hope to stand a chance to understand another person, particularly another person who's not able to as fluently communicate it as another patient, is to approach patients from as many dimensions as possible to build up as realistic a picture of who that patient is, what they want, what they need, what will help them, what will harm them.
We do games such as Skittles, which we've done today. We do puzzles, just a bit of art, anything really, just to give the patient something to do while they're here.
That all has a massive impact on length of stay. That gets them better quicker, because as you can think, if you're sat there, sort of no cognitive stimulation, then health-wise you're not going to improve.
Be aware of the form, which is This Is Me, that we promote quite a lot on the ward, and that is such an important piece of information. With that piece of information, like I say, the patient becomes a person, and because you've got that little bit of information regarding their family, what their likes and dislikes are, you can then see what type of person they were, what things maybe that they would enjoy. We've had a few ladies that won't drink unless it's in a china cup. It's silly little things that actually the communication is really important for.
Only by working together as a team and a true team. So it's a team who interacts with each other, who understands the importance of communication with the patient and with relatives and with one another. That's when we can start to try and chip away at the issues.
The staff in here is very good. I mean,
yeah,
you've come on leaps and bounds, haven't you, since you've been in here?
Yeah, they're nice people.
We get on so well with relatives that most of the time we know all their names and things. And it's nice to be able to speak to the patient and talk about, oh, you know, so-and-so came to see you yesterday and he said he'll pop in tomorrow, and it's lovely to have that like bond with patients and family.
The People with dementia are amongst the very most vulnerable people and the ones that harm can disproportionately happen to, and very often when harm happens it can be catastrophic. For example, a patient falling in hospital who fractures their hip has a much higher chance of either dying or ending up needing to go into care when that person might otherwise have returned home.
These were responsible people with responsible jobs, bringing up families, being the breadwinner. You can't talk to them like the children.
It's got implications for all tiers of staff, clerical or healthcare assistant or phlebotomist. All of these people have a role in interacting with patients and ensuring the environment is safe and secure, and they're part of the team.
I once had a gentleman that was in, and his son said to me, "Look, don't worry about me, Dad, if you see him getting up at 5 o'clock in the morning, putting all his clothes on the bed." 5 o'clock was the time he always used to get up for work. So that is his normal pattern. So rather than saying to that patient, "Get back in bed," it's, "Are you ready for a cup of tea?" You adjust the way that you nurse that person according to what that person's needs are.
The way to assure effectiveness is to ensure that the treatment you're giving is wanted. So finding out what a person's wants are and their needs is critical.
What staff need to remember is when they're nursing patients that have got dementia, try and look beyond what the initial facade's showing and try and see what's beyond that. So if a patient's being aggressive, have they got pain? Are they hungry? Are they tired? Are they scared? So there's all those elements that can affect how that patient reacts. So it's a case of trying to eliminate it and try and reassure that patient to make them feel better and safe.